I'm going to be performing a modified Knots test. This is a blood test to concentrate microfilaria, as well as be able to differentiate between dirofilaria or any other sort of nematode blood circulating microfilaria. So I'm going to go ahead and get my blood in my tube. I got a 20 gauge needle on here to drop that sample. As you can see, I have 1 ml of blood. I think you can see that okay. I'm going to go ahead and place that into my conical tube. Inject that. Place the lid on that while I draw up my formalin. And I'm going to draw up 9 mils. And then you can see there are 9 mils of 2% formalin. So I'm going to place this in my tube as well. Inject that right in there. Okay, perfect. Peel this off entirely. Make sure we get a really good seal. I'm going to hold my finger on the top and I'm going to go ahead and invert it a whole bunch, kind of mix it really thoroughly. Right, so I'm going to be placing my tubes into the centrifuge. I have my balance right here. It's about the same amount. I'm going to set that on one side, and then I've got my tube to place on the other side with my sample in it. I'm going to shut the lid, and then I will turn my timer to 5 minutes. Alright, and it's going to spin for 5 minutes, and then when it's done, I will remove the tubes and we will continue. Alright, so now I have my test tube sample. I'm going to uncap my tube. I'm going to gently pour off the supernatant in this sink right here. Okay, so I'm going to go ahead and do that. As you can see, there's that little bit of white on the bottom that we were expecting to find. The centrifuge that I used uses a 45-degree angle, so it brought it up more at a slant. My new methylene blue stain. I have my pipette right here. So I'm going to take 1 drop. I use my pipette to mix it around. So I'm going to pick up a drop. And then I'm going to place that on my microscope slide with glass cover slip. So I'm going to go ahead and place that on top. There we go. And now I can examine under my microscope. Great. So now I'm going to examine my slide. I've got my microscope on. I'm going to go ahead and set it down. Raise my stage up. And I'm going to start on 10 times magnification, and then I'm going to increase because I'll be examining at 100 times magnification. Okay, so I've moved to my 100 times. Magnification. I'm going to start in one corner of my slide and methodically move through to check for any sort of microfilaria. Okay, so that concludes my test. Based on what I see, I do not think that this dog is positive for heartworms, which is good for her, so I'll let my doctor know. So a little bit about our fecal testing, the different types and why we choose to do them. So for our direct smear, it's going to be the simplest evaluation. Multiple bodily fluids can be examined through this smear. It's not a very good test for your parasites because you're only taking such a small amount of feces that it's likely that you would miss something that was present. So that's only going to be used if you're really just looking at more like fluid content and what is kind of making up those feces. For our simple float, that's going to be the easiest and most thorough option to check for parasite eggs. That's what normally is done in private practice. Our simple float with centrifugation, I think that's how you say the word, is going to be just like our simple float, but it's going to be a little bit more thorough. It's going to be able to catch more parasite eggs and cysts through that feces that we collect. The only thing that's difficult about that is it does require more like a special centrifuge, because you use larger centrifuge tubes than what a lot of practices have the capability of. And then our sedimentation test is really only done for large animal parasites, or if we're thinking that a patient could be infected with the parasite where the eggs are going to be too heavy to actually float in that fecal med solution. So that's why we're going to do the different tests that we have, and we'll go ahead and demonstrate how those are done. So now I'm going to do our standard fecal flotation. So what I'm going to do is I'm going to use my designated cup to mix the fecal matter with my fecal med solution. I'm going to use this tube and gauze to pour it into, as well as strain it. And then once I get it almost full, then I'm going to move it over here, fill it the rest of the way, and place my glass cover slip on top and let it sit for 10 minutes. So I'm going to go ahead and do that. Mix it in my cup. See right here. My fecal med solution in there. Then make sure I mix it really, really well. Fill it up to the top, and then fill it up all the way. What I want is to make a convex dome on top, so I'm going to fill it up just a little bit, get some of that surface tension, not overflowing though. You can see that. There we go, it's got a little bit of surface tension. Alright, and then I'm going to take my glass cover slip, which is right here, and set it on top. Alrighty, so now it's going to go ahead and sit for 10 minutes. Okay, so it's been 10 minutes since I started the fecal flotation, the simple fecal flotation. So I'm going to go ahead and put that glass cover slip on a slide. Okay, so I took it off of the top of my vial and placed it on my microscope slide. Alright, so that's the end of my sample. I did notice a few hookworms, probably only just one plus, really nothing much there. But I'm going to let my doctor know. This dog was coming in for some bloody stool, so hopefully this will be able to resolve the issue. And that's going to be the end of my test. Now I'm going to be doing our fecal float with our centrifuge. So I've got my designated cup, my red top tube that I'll strain it into, a tongue depressor to get the feces, as well as my gauze. And I've got my fecal med solution to put into my cup. So go ahead and get started. Fill with some solution. Alright, and then I'm going to make sure I mix it up really well. Alright, so now that that's mixed, I'm going to go ahead and get my red top tube, place my gauze over the top, and then I can go ahead and pour that in. Alright, I'm going to go ahead and close that, and go ahead and add my cap, and then we're going to go take this to the centrifuge. So now I have my sediment, and we're going to walk back and set it up. So I'm going to go ahead and open that. There we go. I'm going to fill the rest of it with my fecal med solution. And then I'm going to place my glass cover slip, you can see, and set it directly on top. Looks perfect. So now this is going to wait anywhere between 10 to 15 minutes, and then we'll read it on a microscope slide. So I'm going to go ahead and grab my sample and then set it on my microscope. So I'll get my microscope cover slip, set it on top of my microscope slide. Sorry. Alright, so I got that set down. Kind of see that right there. I didn't really see anything as far as parasites go. I did see what I think is some organic material, like maybe some grass, but nothing that I would be concerned about. So that's me. So now I'm going to be doing our direct smear. I'm going to take a cotton tip applicator. I'll use the base end of it. I have my microscope slide. I'm going to put a little bit of feces on my slide, put a little bit of fecal med solution on top, mix it together really well, and then smear it out. Then I'll remove any sort of like larger fecal debris. That way I can place my cover slip on top and examine it under the microscope. So do a little bit of feces. I'm going to take this, set a little bit on top. I'm going to put a drop of my solution. I'm going to mix it around really well. Alright, so got it mixed up pretty well on there. I'm going to go ahead and just drag the base of my cotton tip applicator across very lightly. Kind of smear that out. Like so. There we go. And then I'm going to place my glass cover slip on top. Like that, and I can go ahead and give it. Okay, so I made sure to clean off the base of my slide before I examine my direct smear. I'm going to go ahead and set this on my stage. Okay, so that's the end of my slide. I didn't see anything on here, but I'm definitely going to have my doctor take a look. But as far as I'm concerned, there are no parasites seen. Okay, so I'm going to be doing our fecal sedimentation. So I have my designated cup that I'm going to mix in with my fecal matter. I'm going to get that out using a tongue depressor. And then as well as I have a red top tube for it to sit in, and it's going to be sitting for 30 minutes. So we'll go ahead and get started. I'm going to get about 2 grams of my fecal matter, get that into my cup. And I'm going to fill it with tap water. Next, I'm going to strain it into my red top tube. Alright, so I've got my gauze over the top to strain it. And I'm just going to pour it directly into that tube. I have my fluid right here, so I'm going to go ahead and recap that, and then I'm going to let this sit for 30 minutes. Alright, as you can see, that is my sample sitting up to be undisturbed for 30 minutes. It has been 30 minutes since I started my sedimentation test, so I've got a pipette with me. I also have a microscope slide to examine and a glass cover slip. Got the majority of the supernatant on top. And so now I'm going to reach in and get just a little bit of that sediment itself, drop that on my microscope slide, and then I'm going to cover it with my glass cover slip. Alright, so I made it to the end of my slide. I didn't see anything on there, just normal fecal material, maybe a few hairs, but that was probably my fault. That being said, I think that he is all clear when it comes to our sedimentation. So a little bit about the different kinds of urine collection. So we like to use our free catch samples for any sort of just like urinalysis or specific gravity. We like them because they're the easiest to do and the cheapest to do. but unfortunately they can't be used for any sort of cytology or culture. So if that's what our doctor is looking for diagnostics, then we're not going to be able to do that or use that method for those tests. Our ideal way to collect a sample for cytology or culture, for culture is going to be our cystocentesis. There's 3 different kinds of cystocentesis that are typically done. You have your blind stick, you can have your palpation, or you will locate your bladder, and then you'll have your ultrasound guided cystocentesis, where you find the bladder, you can see the void, which is kind of the fluid that's present in the bladder, and then stick your needle and syringe down to get your sample. The cystocentesis is the gold standard. That's what we would much rather have. But in times that you cannot stick into the bladder, such as maybe there's a bladder tumor or something that you're worried about rupturing in particular, you can pass a urinary catheter. For our male urinary catheterization, it is not the best that we could do. We'd rather have a cysto, but when in doubt, it will be very handy for cytology and for culture. There's a few different types of urinary catheters we can use. So our red rubber and our polypropylenes are going to be our most common for just our temporary samples. But then there are like Foley catheters if you plan on placing them for a longer period of time, where they'll be not fully permanent, but they will be stationary for a while. So that's a little bit about our urine collection methods, and now we can demonstrate how to do those. We're going to perform our free catch urine collection. So what we're going to use today is going to be this pole we've got. It holds a little cup on the bottom of it, and then this disposable plastic cup that will fit in to collect the urine itself. To get the sample out of the cup, I'm going to use a 10 cc syringe as well as the casing, and then I have my red top tube and my needle to place on my syringe to put the sample into a red top. So the main thing that we're going to use this urine for from the free catch is going to be just for our urinalysis, kind of take a look at it. It's not going to be used for any sort of cytology or culture because of its likelihood of being contaminated in that aspect. When we obtain our samples, we want to make sure that we obtain morning urine. It will be the most concentrated, so that's going to be where we're going to get our best results and most accurate results, as well as we want to make sure that when we are collecting our sample, that we collect midstream, so not the first initial urine to come out and not at the very end, that would likely not come out in a good stream, but right in the middle. So I'm going to grab my patient. He is going to be coming in because he needs to get his specific gravity checked, because we're not really sure if he's concentrating well enough. So I'm going to grab him and we're going to... So I waited until some of the stream came out initially to go ahead and miss the beginning. Then I'm going to go ahead and collect my sample. That looks like plenty. I've got my syringe. I'm going to go ahead and draw it up. That looks like plenty. And then I'm going to place it back into my casing. That way I don't have to worry about it leaking. And then I'll take it inside to put it in a red top tube. Okay, so now I am back inside with my sample. I'm going to go ahead and get a 20 gauge needle. I will remove my syringe from the casing and place the needle on it. And then I have my red top tube right here, so I'm going to go ahead and uncap my needle, place into the red top tube, let it fill up all the way. And then I'm going to not recap my needle with my hand. Go ahead and get that needle back on. And here I have my sample. I'm going to make sure that it's labeled. And then go get that specific gravity ran. So our cysto, my technician has a 10 cc syringe with a 22 gauge 1.5 inch needle. We're going to do some alcohol in her abdomen and do an ultrasound guided cysto. So she's going to put some alcohol on her ventral midline. We're expecting the bladder to be just caudal to her umbilicus. Alright, so we're going to uncap our needle. She's going to poke right on that ventral midline. Dorsocaudally into our bladder. We're going to aspirate back our urine. She made sure not to redirect her needle while she was poking for the bladder. Right? And then she's going to go ahead and remove the syringe and the needle from the patient. She was in dorsal recumbency. I'm going to go ahead and unscrew my needle. I'll place a clean needle on, that way to avoid contamination with my sample. Go ahead and uncap my needle, place into the top of my red top tube, let it inject. Placing a urinary catheter in this male canine, that way so we can get a sample. So what we're going to do first is he's going to get in lateral recumbency. We have our SpO2 monitor on him, as well as our technician is going to be monitoring his heart rate the entire time. So we've got our red rubber. We're going to estimate the length of the red rubber based on double the size of the length of his penis. So about right there, so we're going to double that. So we're going to probably insert it about this far. This is our sterile red rubber catheter. I'm going to go ahead and open up, or should I be like 6.5 now? I'm going to go ahead and open up these sterile gloves for my technician. Let her close. So I got my baseline swabs so that I can clean his penis. I'm going to come over here. I'm going to extrude his penis. Okay. Next, I'm going to open up our sterile loop. It's been sterilized. I'm going to open that for my technician, as well as open up our sterile catheter. There we go. So she's going to be inserting this catheter. I'm going to take the initial sample, which is going to be about 2 ml, and then discard it because it's likely to be contaminated, and then I'm going to draw the rest of the sample. So she's going to go ahead.
Is this an AIDS?
Yes. She's going to sterilely lubricate the end of the catheter and then insert it. Let's see. Go ahead and attach her syringe. Let you do it.
I'm not let you do it. It's sterile-ish. Maybe because it's just so small. There we go.
Alright, so the first part of the sample. Okay, do it. There we go. Let's try it. Alright, so that could be all that we're going to get initially, so we'll go ahead and remove that just in case we want to make sure that we don't waste that sample. Then I'll go ahead and attach my 12 ml syringe. A little bit. Little bit. All right, but you know what? We got a little bit of a sample, so we're going to go ahead and remove that. So there's a little bit of my urine. I'm also going to save the other syringe just in case because it isn't much of a sample. I'm going to go ahead and attach my 22 gauge needle, and then I can put this into my red top tube. Insert that in, and there's my sample. And we removed our catheter in case you can't see, but he's definitely very alive. Here we go. Today I'm going to be doing an ear cytology on our patient Zip. He's presented to the hospital today for shaking his ears and his ears being malodorous. Ear cytologies are commonly performed to diagnose outer ear infections. So I'm going to take my cotton tip applicator, insert it gently but directly down into the ear canal, swab around to get some debris. Perfect. I'm going to go ahead and pull that out. So this is going to be my right ear. I'm going to set it to the right side of my tray. This is going to be my left. All right, so to prepare my slides for my ear cytology, if you look closer, I have my slides labeled with my patient's name as well as the direction of which ear it was, whether it was left or right. I am going to be making 2 slides for each ear. That way I have one slide I can stain and one slide that can just be examined under the microscope with mineral oil. So I've got my swab. I'm gonna just roll it across the first slide, and I'll So I'm gonna let one from each side dry really well so I'll be able to stain it, as well as I'm gonna go ahead and take a drop of mineral oil. And I'm gonna take my glass cover slips. So now I'm going to stain the slides that I let air dry. So they've air dried completely. We're going to be using Diff Quick Stain that is specifically for ear and fecal material only, not just the hematology stain. So I'm going to go ahead and pick up my first slide, and I will dip it in about 10 times. And then I'm going to gently rinse it underneath the sink. So as those are drying, I'm going to go ahead and examine the first slides that have the mineral oil and the glass cover slip on it. I've got my left ear slide here. My microscope is already turned on with my stage down so I don't damage anything. So I'm going to go ahead and raise my stage. Okay, so right now I'm looking underneath the 10x field. So I'm going to look around, see if there's any larger bacteria that I can see, or yeast. I do have a lower level light on. I'm just kind of looking for my gross examination. Overall, I don't see anything very exciting. I am methodically moving through my glass cover slip to determine if there's anything present. Alright, and I can pretty confidently say I don't see anything on that slide. And then I can look at my right one. So I definitely see more debris. It does look very brown. Lots of little spicule debris across the slide. I do think based on the level of debris in the right ear that I'm likely to find more bacteria or yeast on that slide. So it will be interesting to see the stained slide. Alright, so now I'm going to go ahead and examine the slides that I've stained. So I'm going to go ahead and start with my left one. Place it onto my stage. I'm going to raise my stage. And I'm first going to examine it under low power, so just under 10x. I'm going to get myself focused. Alright, I'm going to go ahead and look around, see if I can find a good area of interest where I might see some bacteria or fungus. And then that way I can move in a little bit closer. Right, so I think I found a good area. So what I'm going to do is move my lens over to the 100 times field and get a drop of immersion oil. Place it directly over my spot. And then move my objective lens over. Get myself focused. So I do see a little bit of inflammatory cells. See a little bit of what I think is some cocci, which is normal to see a little bit. So while I would say for this year, there's probably no significant findings. Like I said, I do see some inflammatory cells and a small amount of cocci, but nothing that I am surprised to see. So I'll go ahead and move my objective lens and lower my stage so I can examine my other slide. For this slide, I would say that I'm probably seeing about 8 to 10 cocci present per high-powered field, which is not that much, but compared to the other slide, I think is fairly significant because they are all located together. But overall, I would say that he probably has fairly normal ears, just pretty dirty, but I'm definitely going to get my doctor to take a look at it, and we'll diagnose from there. So today I'm going to be performing a skin scraping. Before I get my patient, I don't want to stress her out too much. I was going to talk a little bit about it. So skin scrapings are commonly performed to diagnose skin infections. Also looking for any sort of like external parasites like mites that could be located on our skin. It's going to be really cheap and an easy way that with good skill we can go ahead and diagnose those issues and treat them appropriately. So I'm going to go grab my patient and then we're going to get started. So I'm going to be performing a skin scraping on this dog right here. She was supposed to go to surgery today, but ended up having a little bit of a skin infection on her belly, and so we're going to go ahead and get a scraping of that. So materials I'm going to need are going to be my clipper blades, my mineral oil, I have a glass slide over here, as well as my 10 blade. So I'm going to open up my 10 blade and get it really dull, that way I don't have to worry about hurting her at all. Alright, so I've got that really dull. I'm going to go ahead and put a drop of my mineral oil on my slide. There we go. And then I'm going to prepare my blade by placing it in the mineral oil. See that? So. Alright, so I would clip the skin to prepare it, but she has already been clipped for surgery, so I don't need to do that. I'm going to go ahead and pinch an area where there's a little collarette and some crusty. Pinch that, scrape it. I want to make sure I get deep enough that the capillaries bleed just a little bit. That way I know that I have gone far enough, and then I will put that on my slide. So pinch the skin just a little bit. I'm going to scrape it with my blade perpendicular to the skin, with a 3 to 4 centimeter squared area. Alright, I think that's good. Place that in my mineral oil. Here we go. And as you can see, there is my slide, and I'm gonna go take that and put a cover slip on. So with my skin scraping, I made sure to scrape superficially to check for bacteria and yeast, as well any sort of like fungal issues, as well as more superficial types of mites like Soptes. I also made sure to scrape really deep. That way I was able to check for any sort of like Demodex or Sarcoptes mange. So Sarcoptes mites, sorry. So what I'm gonna do is I'm gonna take my slide, walk it down to where our microscope is kept, place a glass cover slip on top, and then examine it under 4 times magnification. After examining my sample with the microscope under 4 times magnification, I did not notice any mites, so that's good. There were no mites located in the sample itself. I did see some skin cells as well as some cocci bacteria present, so I will make that known to my doctor, and they are going to come check out my slide as well. I did also increase the magnification to 10 times just to take a good look and look all around, make sure I didn't miss anything, and I am confident with my findings.